One day I was home and I got an envelope, United States lottery. I eventually called my friend. I did it for 15 other people and you are the one that won.
Get out.
Yes.
Oh, you just gave me chills.
I wanted to take care of the underserved population more. All I wanted to do was to open my practice. One day the light bulb just clicked and it's like, what are you doing? People need COVID vaccine. Boom, I opened my doors. I started giving COVID vaccine.
Tell them where your spot is.
It's very cozy and beautiful. A lot of people walk into your door, they need somebody to talk to. And I do a lot of that over here.
Have you found that there's a specific community coming to you that has otherwise not been getting care?
The African community itself. I'm very glad that I have the opportunity to serve them.
It's exhausting, but it's also filling.
That is what you jump out of bed and say, I need to go see my patient every day. I want to open up a daycare for younger people who have no purpose, to be able to house them, mentor them so that they will find their purpose in life. Focus on your path and persevere, and you will get there.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future. We're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives through their practice, making a real impact in their communities. Let's get into it. Today, we have Eva Nyarko, an NP from the Bronx. She came to this country as a young woman with nothing but her brains and her determination. Whew, boy, does she have determination. And now she has a thriving practice called Caring Link, and she's about to open up her second. You won't want to miss this story. Eva Nyarko, thank you so much for being here.
Thank you.
So excited to have you.
I'm excited as well.
Tell everybody where your office is.
I'm on 650 East 226th Street. It's in Bronx, New York.
Bronx, New York. I love it. Okay, so let's start from what led you to even become a nurse practitioner?
That's a very good question.
The big exhale, you're like, I don't know.
So after working in emergency room for about 15 years, I wanted something more. I wanted to take care of the underserved population more. Didn't really know what to do, but then I decided, you know what? I think I'm going to go to MP school and see where it takes me. And that was how I got into MP school. And whilst I was getting into MP school, all I wanted to do was to open my practice.
Oh, so you knew from the get-go, like while you were in school, I'm just going straight to, and did you go straight into practice? Did you go straight into your own practice? Or did you go somewhere first?
I worked for 10 months in occupational health, and I felt as if I was dying. So
no way. Why? Because it was like the same thing over and over again, or what?
The same thing. And coming from the emergency room to occupational health, I felt as if I was trapped. Because in the emergency room, I was always running, and then here I am sitting down to wait for patient, and I'm like, I cannot do this. I can't do this. Yeah.
It's so true. It's so true. Anyone who comes from I came from ER also. Anyone who comes from the ER, it's like, what is this? I cannot do it. That's so funny. So 10 months, and you're like, I'm out. So what'd you do?
So then I have to figure out how to set this practice up. So I figured out if I'm going to this job in occupational health, I literally don't get the time to be able to start putting things together. Fair. So then I said, you know what, I'm going to look for another position that will give me the leeway. So then I got a position as the assistant director of nursing in one of the hospitals, and then also as a nurse educator. So that was where, I put my education cap on, and then I started, looking into stuff. How do I start a practice? I got onto this nurse practitioner that I had, and I fell in love with her, Barbara Phillips. And I
Yeah.
was like, oh, I need to follow this lady. So I started following Barbara Phillips and, getting hints here and there. So I started putting things together, got the business registered, got my business plan and everything, and then kept going until finally I was done to open, but then boom, COVID hit.
Oh, okay. And you know what? And that brings me to a good point because almost everyone I interview before we get to the COVID moment, we talk about how we make a plan, and then the plan is you could just use it for wallpaper and other
Yes.
paper. Like the plan is never the plan. So you had this perfect plan, you wrote it out, type Times New Roman 12 font, and and then COVID's like, JK. So
Uh,
what happened? How did that set you back? What happened?
so then when COVID hit, because the space that I was going to do the practice in, it's also a resident as well. So I was sort of scared to bring COVID in there. So when COVID
Interesting.
hit, I felt as if, this plan is not going to work. I might as well just let it go. So I let it go for a while.
So what
And
did you do?
then
You didn't work?
I was
Okay.
working
So
as still as a nurse
okay.
educator, assistant director of nursing, and then one day the light bulb just clicked, and it's like, what are you doing? People need COVID vaccine. So I said, oh, okay, maybe I could start a practice with COVID vaccine. So boom, I opened my doors. I called the state. I got vaccines in, and I started giving COVID vaccine.
Ma'am. Okay.
So yes. So with the COVID vaccine, then people start, oh, are you here? Oh, is there a practice here? Oh, so that's how it all
Wait,
began.
and is that the spot you're in right now?
Yes.
So you already had the spot, but you were nervous about it, but then you were like, it's okay for vaccines because some time had passed.
Mm-hmm.
Now, I've been to your spot,
Mm-hmm.
and we can't just call it the spot because people need to understand this is a very unique spot. Tell them, Sister Eva, where your spot is.
So my spot used to be for the Roman Catholic nuns. This was where the sisters used to live. So it's sort of like I like the charm that it brings in with it.
It looks like a church.
It looks like a church, but then it's very cozy and beautiful.
Sure
And
is.
I really fell in love with it because I believe a lot of people walk into your door, and at times it's not even all about getting sick, but it's all about they need somebody to talk to. They
That's
need
true.
somebody to vent to. And I do a lot of that over here. And I feel as if that actually brings me into the space that I wanted to be because, yes, my husband is also a pastor. So I'm actually living and doing both things together, doing my counseling, seeing patient, and I'm really happy.
So your husband's a pastor, and then your practice is in kind of like a church,
Mm-hmm.
and you're doing counseling. So like, I just need people to get the visual because when you walk in to Eva's office, like you just hear the angels singing. Yeah, because the building is like, it's it feels like a holy building, and I'm not Catholic. So you just walk in and you're just like, oh, and then it's a great spot. And it was really smart of you because if I'm remembering correctly, it wasn't a building that anyone really wanted.
No, it was actually an abandoned building when I got it. This was around 2011. My husband fell in love with it. I'm like, what are we going to do
What are
with
we
this?
doing with this? Nobody wants it.
He said, no, we like it. This is what we should get. So I said, okay. At the time, I didn't know this was what we're going to use it for. But then,
Oh
God
my
works his
God.
ways and it
That's
came.
true. Anyone out there, go find an abandoned building.
Yeah.
So you started off with COVID vaccines and then you transitioned into primary care?
Yes. So when COVID started dying down, of course, the patients that came in actually found me and word of mouth went out. Oh, we have a doctor over there. We have a doctor over there. It's a black doctor. He's so nice. And then I started having patients coming in. And I'm very grateful for the patients that I have now.
So say more about that. I love that you said it's a black doctor because what we've discovered is visiting all these NP practices, is that NPs are setting up practices in communities that are underserved. So while I know your door is open to everyone, have you found that there's a specific community that is coming to you that has otherwise kind of not been getting care?
I do. A lot of the Jamaicans, a lot of African Americans, a lot of just the African community itself find it very safe to come in here. So I'm very glad that I have the opportunity to be able to serve them.
Yeah, and it's so good to do, like to have someone from your own community. I mean, again, my doors are open to everyone, but obviously the LGBT community feels safe when they come to me. And I have Black and brown providers, and I know that there's a gravitation towards them because we could trust. There's a certain trust when there's an understanding of culture, and I can imagine also that when you are, for example, and please correct me if I'm wrong here, but if, for example, giving advice on nutrition, you're going to give an advice on nutrition that has that cultural knowledge that I wouldn't have.
Exactly.
Okay.
Exactly. That is so true. Where I come from, I'm from Ghana originally, and our diet most of the time is made up of carbs.
Yes.
I have my patients that are diabetics, or hypertensive, and so it's easier for me to tell them what is best for them to eat and not to eat. It makes it easier, and they're happy because then they understand more where it's coming from, why they shouldn't eat what they're not supposed to be eating, or why they shouldn't eat what they're eating.
That is amazing. And so how many days a week are you open right now?
So I'm open 5 days a week. We do Monday, Tuesday, Thursday, Friday, and a half day on Saturday.
Half day on Saturday. And how big is your patient population now?
So right now, around 3,000 patients.
Okay, so we went from COVID vaccines to 3,000 patients. That's a big deal. I'm loving this. And do you give yourself one day for admin?
Yes. So that's my Wednesdays, do admin, run around for things that I haven't done.
That's the catch-up day.
Yeah.
How do you manage your clinical responsibilities and your business responsibilities? Oh, there it goes right now. There goes the phone.
I know. When you're a nurse practitioner and you're coming into business, at times we don't know the business aspect of it, so it's a little bit difficult. In the beginning, I was doing this all by myself. Now my daughter have jumped in and trying to help me out a little bit because we're planning to open a new location. So she's coming on board just to make me navigate the business aspect that I don't know much of. I think in the beginning I was very naive, but now I'm trying to.
We all were. Nobody knows what they're doing. This is the recurring theme with every NP.
Yes.
We start off with our heart, and then we're like, wait a minute. We actually need some money. We actually need some help.
Yeah. And thankfully, I also had Duet come in and help me out on my billing aspects of it. So things are getting to fall into place, and I'm very excited about that.
Are you opening a second location or switching locations?
I'm opening a second location.
Oh my God, that's amazing. Who's going to be there? Are you going to be in both places?
No, I'm going to eventually hire a nurse practitioner.
This is big. What made you decide that you need a second location?
So I'm getting into a contract with the VA to do the VA assessment.
I got you.
And there's a few things that I needed that I don't have it here.
I got you.
Yeah, you know what? I think it would be great to have another location somewhere else I found this beautiful place that I felt it really will work out for me over there. So I decided, you know what? Let me jump in and let me just open another location over there and see how it goes.
Okay, so that's going to be like the VA location place.
Yes.
Okay, amazing. I love that for you. How did you get involved in that?
A friend of mine actually introduced me to that.
I love that. I love that so much. Okay, so now is it just you or do you also have staffing?
It's me, my medical assistant, and my daughter's coming on administrative Y, and then I have a VA.
Okay, so 3,000 patients, one medical assistant, and one VA. That's your whole team?
Yeah.
I love that. That is a very streamlined team.
Mm-hmm.
So the medical assistants there, like answering the phones and doing the vitals and all that as well?
Yes. And then I do a lot of training for nurse practitioners. So they are like my bump up, they come and they help me.
Oh, that's nice. Oh, like students come through.
Yeah. So I
Oh,
do a
that's
lot of precepting.
okay.
So
That is great.
some of the days I have maybe two of them here at a time, so they help out with the patients as well.
That's great. It's a great, other NPs who are going to be listening to this or aspiring NP entrepreneurs. It's great because everyone has a different model. And I
Mhm.
would say that yours, considering your size, is really really streamlined. So one MA, you yourself, and then utilizing students is a great idea. How much time ish do you spend with your patients?
It depends. So for a new patient, at times I go depending on their complexities, anywhere from half an hour to 1 hour. If it's just a regular visit or a follow-up, then it's easier. If we are very busy on that day, that I don't get to, chat with them for a long time. But if not, and it's not busy, I try to spend as much time with them as possible.
You are so good. You're so good. So what's a typical day like for you as a practice owner?
So a typical day where we are, we have a lot of patients coming in. We're talking about maybe having about 18, 22 patients, they come in from morning. I open from 10 to 6.
Mm.
So
And is there like one either habit or system that you learned along the way that really changed the game for you?
habit that I learn around the way is customer service is everything.
Ma'am, say more.
Customer service is everything, and how you treat your patient is everything. I've had a patient walk in and go back and bring the whole family.
Mm-hmm.
And most of the time I have my patients, I ask them, how did you find me is one of my questions. And then two, why this place? Why did you choose to come to this place? And then at the end of the day, they're like, man, I've never gone anywhere that I felt so comfortable, you know.
Wow.
And to me, that speaks volume.
Yes.
Patients should be able to feel very comfortable when they go into a practice so that they will, voice why they come there without getting scared or without feeling that maybe they're going to be rebuked or anything like that. Right. So I try as much as possible to make it as comfortable. And I could tell you 80% of my patients will say, I've never been to any doctor's office that I felt that comfortable.
I love that. And so I could already tell that you like put your personal values into it and the
Yes.
things that are important to you. So besides this time that you take with them and make them comfortable, anything else that you feel that makes your practice unique or different from the others in your area?
The unique thing to me, I think, is the care. It is the care, Efrat. So if a patient walks in your door, there's a lot of things that are going on in their minds. It is their first time coming in here. They don't know this provider. Something is wrong with them. They are sick. They don't know what it is. How do you make their visit memorable?
Mm.
To me, that's one thing that is running through my head when they walk into my door. This new patient that I'm going to meet, how do I make her life or his life different than how he walked in or how she walked in?
I love
And
that.
I think with that, as with that being at the back of my head, it has really transformed a lot of patient that walks into my door. It's not just a matter of, insurance or money, take and eat, or take and go over there, but it's a matter of, I hear you, I know where you're coming from,
Mm.
I understand what is wrong with you. And to me, I think that is paramount than anything. Of course we all want to make money, of course, but human beings first.
Human beings first. It seems so obvious, right? But yet it's not obvious.
No, it's not.
So, you know what I find also, and I'm sure that you find this also. I find that when when you give that to your patients, I come out some days at the end of a clinical day and I feel like I got more from them than I gave.
Yeah.
Like when you hug your patient and your patient hugs you and they tell you like all these things, you're like, I have a purpose. This is the
Yes.
purpose. And
Yes.
today was purposeful. And it's filling. It's exhausting, but it's also filling.
It's
So
fulfilling.
it's
And that is what
fulfilling.
makes you jump out of bed and say, I need to go see my patient every day.
Yes. I love that.
Mhm.
What's it like in the community? Does everybody like recognize you when you're out shopping?
Yes, I've had a couple of, oh, doctor, is that you? I said, oh, there's practitioner. Yes,
It
I've had
happened
a
to me this
few.
happened to me this
Oh,
morning. I took myself out to the diner and they were like, Dr. E. And I was like, oh, okay. Good morning.
yeah, 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 yeah.
That's so funny. Um, what words of wisdom do you have just in general about running your practice to the starting NP?
Perseverance, be focused on the vision. You know how you want it. Everybody's path is different. Focus on your path and persevere, and you will get
Right.
there.
What is your vision? Are you allowed to share it?
Efrat, you're too much.
To have more
So
practices?
practices, yeah.
Oh, wow. Okay.
I want to have a I want to have at least 3 to 4 practices. I want to also open up like a daycare for younger people who have no purpose to be able to house them and mentor them so that they will find their purpose in life.
What? So, like young people, are we talking kids or like 20, 30s?
No, I'm talking kids, I'm talking anywhere from like 10, 8 year old to like 18-year old. That gap.
So, like a youth center with
Yes.
mentorship to help them. What?
So
What?
like a youth group home,
Wow.
kind of youth that have nowhere to go, youth that have nobody they could look up to actually bring them together like in a group home setting and, mentor them, give them education, try and help them with the paths that they want to go. And
Why? Why is that so important to you?
that is so important to me because I am originally from Ghana. My dad died at a very early age.
Sorry.
My mom was very adventurous, but my mom was also uneducated. So I was sort of navigating the system on my own. Coming here, I didn't know I was ever going to come here. I had no clue of how I'm going to come. And when they talk about coming to America, that was not part of my thinking because I have nobody then. But then I had a friend back home that her dad came to pick her up and brought her to the US. And so one day I was home and I got an envelope. And in this envelope, it says United States Lottery. And I'm like, lottery? What is this lottery? Who did lottery for me? And I looked at it and it's a bunch of information. I have to fill the form. I have to, it's a lot of things that I have to do. But at the back of my mind, I'm thinking, but who did a lottery for me? So I started calling people that I know, and I eventually called my friend. And then she jumped and yelled and she said, oh my goodness, I didn't even know it was true. I did it for 15 other people and you are the one that won.
Get out. Oh, you
Yes.
just gave me chills.
Yes.
How old were you when you landed here?
When I came to the US, I was 24 years old.
And clueless.
Clueless. Nobody, nobody, nothing except a
How, where
friend.
did you go? Where did you sleep? What did you do?
So I came to my friend. My friend was here.
Oh,
So
okay.
she actually housed me. And then she told me one thing. She said, I don't care what you do over here. Make sure you get education. Education is free. So I literally, she used to go to Borough of Manhattan Community College. So
Yeah.
I didn't know what I was going to do. I just signed myself in school and started going to school. And I got it. I got taught for free. My fees
Yeah.
were all I have
Yeah.
to do to get to school. So I went to school, and then through there, I went into nursing.
Oh, wow. What a story. You
Hmm.
are the story. You're like, oh my God, that's a crazy story. Wow. I love that story. Now I understand why you
Hmm.
want to be able to basically do for you what your friend did for you, do for
Exactly.
others. I'm saying that's amazing. Oh my God. That's a
Hmm.
vision. That's a vision. Oh my God. I wasn't ready for that, Eva.
Yes.
Oh my
Yeah.
God.
Hmm.
So now I know your goals for your practice and your community. We're going to open up at least 4 practices and we're going to open up a youth center. And anyone listening to this podcast is going to donate to the center, obviously. You have to.
Please do, please do. So The other practice is going to be psych, and then so I'm finishing my psych MP in May.
Oh my God.
I'm going to do the psych.
You're in school right now? Praise the Lord. I thought I was busy. I'm exhausted just listening to you.
I told you I'm learning from you. I forgot that the bigger part of the story is that after school, I went to a conference. My professor was like, if you do anything, go for a conference. I finished MP school 2017, and I said, I'm going to go to this ANP conference. It's the Next Practitioner Association of New York, and it was in Saratoga Springs, and I went. And guess who I met at that conference? They introduced this person. They said, oh, she's the first nurse practitioner that has opened up practice. And I sit at the back and I'm like, I need to talk to that lady. Whatever I do, I have to talk to her.
That's so crazy. Did we talk that day?
I talked to you. And I said, oh, hi, congratulations. You opened up your practice. And yes, I said, I would love to come and learn from you. She said, sure, come anytime you want.
And then years later, we reconnected.
We reconnected. Yes. That's how the world is.
So we were meant to meet also.
Yes.
Obviously. Oh, I love this. You're giving me chills like on every level.
Yes. Yes.
Hey, Eva, I could talk to you all day long. All right. This is like, how do I recap this? I mean, you have her practices in the church. She has a mission to help others. She came here with absolutely nothing. We met years ago, and I got amazing. This is like the most amazing story. Okay, tell us something surprising that most people don't know about you.
Oh God, what most people maybe don't know about me? Of course, I'm a pastor's wife, so people know. So what most people, I'm very adventurous.
Oh, okay. I could see that.
Very, very adventurous. And yeah, that's one thing I could say. I'm very adventurous. I see something I want to go for and I go for it.
That is so clear. Do you have any hobbies? Do you have time for hobbies?
I love to travel. I don't have time for it now, but I try and travel at least once a year.
God bless.
I love to travel. I love the family. So once a year we go out together.
I love that. I love that. Mm-hmm. Oh my goodness. And if you were not an NP, what do you think you'd be doing?
I don't know what I would have been doing, but I know it will be something very adventurous in the business world. Okay.
You still own a business?
Still own a business, but I don't know what it was going to be.
I love it. And maybe you'd be selling candles. Hello, I still have the candles.
Maybe.
For those listening, Eva's daughter makes candles, so.
Yes, Eden Locks candles it is.
Yeah, you see? All right, Eva, any other last words, advice, anything that you want to tell our audience that maybe I forgot to ask?
Anything I want to tell the audience, if you're listening to this podcast, you're a nurse practitioner coming up, I'm telling you, it's a vast world in there and a lot of people need our help.
Amen.
So please, 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 whatever you have to do, if you need mentorship, if you want to speak to somebody, Efrat is right here. She have all the info, I'm here if you need a resource, but it's a really vast world out there. And I think MPs are needed more than ever before. So don't count yourself out.
So true. So true, Eva. That was a good advice. Good advice. Eva Nyarko, thank you so much for being here.
Thank you. Thank you. Thank you so much for leading the way that we can follow as well.
You're so awesome. Thank you for leading the way. That's a wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. Want to join the largest NP practice network? Learn more about how on duet.com. Until next time, keep pushing boundaries and proving what NPs can do.